COVID commander and my ministerial colleague, Minister Allen, Minister for Aged Care and Disabilities, amongst other things. So currently there are 63 active cases of coronavirus in Victoria. 11 new cases were announced in this morning's report. 9 of these are locally acquired. 6 we announced yesterday as having coming through shortly from the night before its cut-off, and there are therefore 3 that I can newly announce today in addition to those 6 previously reported yesterday. 2 of these 3 are primary close contacts who were quarantining during their infectious period, which is good news. 1 is still under investigation. They are not a known contact and are not directly linked to any exposure site, but there is very close proximity to that exposure site, and we're confident that the investigation that's ongoing will uncover further crossover points. Our public health team are actually seeing more and more of this in this particular South Australian hotel outbreak playing out a bit differently to earlier outbreaks. There is evidence of casual acquisition instead of those in direct close contact like friends at a pub, family members, and I'll get the COVID response commander to report in more detail about some of our specific priority concerns in this area. I can also update Victorians that the aged care case yesterday, the first one, the R-Care worker, the genomic sequencing has confirmed that that case is directly linked to the South Australian hotel outbreak quarantine. And that is at least confirming in our mind that this is all the one related cluster from the South Australian hotel breach. I'm also able to advise that all staff and residents at Blue Cross Sunshine Aged Care Facility have tested negative, other than that one case we reported on yesterday. That was the crossover worker between R-Care Maidstone and Blue Cross Sunshine. There have been no further positive tests at R-Care in Maidstone as well. Of course, these sites remain under strict infection and prevention control measures, and I want to particularly thank the Western Public Health Unit for leading that work, and I want to thank again the wonderful clinical staff and particularly the nurses from both Melbourne Health and Western Health who have stood into these important infection prevention and control measures, and to support both those facilities as a result of their own staff having to be furloughed and quarantined. I can also advise that another Blue Cross facility which shared a worker advised that we talked about yesterday, that site has been stood down as an infection risk as the particular worker was not infectious at the period that they worked at the other Blue Cross site. That news aside, there continues to be significant concerns around ongoing transmission in particularly our northern suburbs and many large exposure sites that have been added to the exposure site list over the last 36 hours. Our public health team are currently weighing up whether there is still coronavirus circulating in these communities, and we still consider our response to the current outbreak on a day-by-day basis. With 20,484 vaccines delivered yesterday, it's been another strong day for our state-run systems, and I want to thank our hard-working vaccination staff for their efforts right across our 30-plus state vaccination centres, and just remind people that equally, in fact, more vaccines are provided to our primary care and GP network, and Victorians seeking vaccinations have 2 options really as to how to meet the increased demand that we're seeing out there for vaccinations: the GP network and our state clinics. We are pleased that the overwhelming majority of frontline healthcare workers in Victoria have already received their vaccines. Effectively, it's at practical completion rates. There is already the firm expectation that healthcare workers in our system, dealing with particularly our highest risk patients, such as those with COVID-19, are vaccinated. And I note that the Prime Minister and the Commonwealth Health Minister have sought medical expert panel to review how we can all increase this density of take-up of healthcare workers and other frontline workers' density even more, and that's a move that Victoria welcomes. And we will keep doing all we can to ensure we're making it as easy and as fast as possible for healthcare and aged care workers in the public or private sector to get vaccinated as quickly as they can. To that end, Minister Donnellan will be shortly announcing further priority access for workers and residents in some of our most vulnerable settings to get the vaccine, particularly in those areas that are a responsibility of the Commonwealth. Finally, there's been another strong round of COVID testing yesterday with over 40,000 tests done. And I repeat the call out that we made yesterday that the Melbourne Showgrounds Testing Centre, which has the largest capacity in the state, still has relatively short waiting times than a number of other nearby and other locations. So I would ask that all Victorians do the right thing with even the slightest of symptoms, come forward, get tested and keep turning out in those numbers. Hop on the website to get the information that you need as to what the waiting times in the closest test centre to you are, because this is how we monitor and track the movement of the virus across our community, respond quickly and move as quickly as we can to shut down lines and chains of transmissions. I'll ask Minister Donnellan to talk about our initiative for testing and vaccines rather, and then I'll get the COVID Commander to explore these issues in a bit more detail, particularly about the current outbreak's latest data. So, thanks, Luke.
Thanks, Minister. Our dedicated and hard-working aged care and disability workers need easy access to the vaccine. So as today, as the Minister said, we're going to make it easier for them. We'll be undertaking a 5-day vaccine blitz to ensure workers in these vulnerable settings are protected against coronavirus. This means from Wednesday the 2nd of June to Sunday the 6th of June, workers in private sector aged care facilities and the residential disability sector, which are all managed by the Commonwealth, will be given priority access to walk-in vaccination hubs around Victoria between 9 and 4 p.m. when they present evidence of their employment. The following vaccination hubs are participating in the 5-day blitz. They include the Royal Exhibition Building, the Melbourne Convention and Exhibition Centre, Sandown Racecourse, the Melbourne Showgrounds, former Ford factory in Geelong, Bendigo Community Clinic, Ballarat Mercure Hotel and Convention Centre, Shepparton Showgrounds, the Macintosh Centre, Tarralgon Racecourse and with the Wodonga Vaccination Hub. Aged care and disability workers are currently eligible to be vaccinated at the state hubs, but this is very much about trying to stimulate that demand, trying to actually get more workers to get greater coverage of the private aged care sector and also the disability sector. We have concerns that there isn't enough coverage, so that's very much why we're stepping in. That has been available, as I've indicated earlier, but this is very much a call to arms of those workers who are on the front line to very much come out. We'll give you a priority lane so it makes it quicker and easier, get through it in a speedier time, because we very much want to ensure we're protecting those vulnerable people in both the aged care facilities and the disability sector from COVID-19. Separately, we're also going to be setting up enhanced accessibility centres for people with disabilities in residential care. So there will be 9 of those centres. 2 of them are up and running already, one in Ballarat and then one in the Royal, are going to be set up very soon. One will we intend to have in Ballarat, another one in the, at the exhibition buildings, and another 7 to come. And these will very much be focused on working directly with the major service providers of residential care for people with disabilities. So to be a direct link, a direct contact between the department and those larger providers to bring in people with disabilities who feel comfortable to actually have their vaccine shot outside of their residential facility. We will have disability liaison officers working with them to ensure that we actually also get greater coverage in that space, because again, we have serious concerns in relation to the coverage of people with disabilities in residential settings. So very much stepping in to assist the Commonwealth in those endeavours to ensure we provide greater protection in the community. Thank you. Sorry.
Thanks, Minister, and good afternoon. Since the start of this outbreak on Monday last week, we've now seen over 317,000 tests delivered and at a rate of over 43,000 tests a day. 90% of those test results are coming back within 24 hours. My thanks to all those people who are coming forward day after day to get tested. It is such an important thing to do in order to give us as much intelligence about where this outbreak is still running as we do all we can to bring it to ground. Over the same last 7 or 8 days, we've seen 116,000 vaccinations delivered in our state-run vaccination centres. We are just shy of 500,000 vaccination doses now delivered through our state-run clinics since the start of our programme. Again, fantastic to see 20,000 people come forward to get vaccinated yesterday. We're seeing some pretty strong demand again today, and my thanks to everybody who's come out today. We also took over 21,000 calls yesterday for more vaccination bookings, and of course that work will continue. We now have 54 active cases in this particular outbreak, and I'll go through some of those in a moment. We've also yesterday undertook over 700 home visits to people who are either positive cases or who are isolating. It is so important that the 4,800 primary close contacts we now have, that they continue their safe and effective isolation. Reports on the ground are really strong. We're seeing really good compliance with people doing exactly that. And my thanks to all those, just under 5,000 people. This is a hard thing to be asked to do, to remain at home, to remain fully locked down for 14 days. It is a significant burden on people. We, of course, do all we can to support that support work will continue. And my thanks to our colleagues, particularly in the ADF, who have come on side over the last couple of days to strengthen our home visit programme to support those who are doing that isolation. As ever, there are, of course, a small handful, literally a small handful, of people who aren't quite complying, and they are being followed through and dealt with as appropriate. There are now, of the 4,800 primary close contacts, 75%, 3/4 of those, have now returned a negative test. That again is an encouraging figure. We're certainly keeping up with our primary close contacts. We are more than hitting all of our national benchmarks, as you would expect here. And of course, we're seeing, as we find out more, as we get more negative test results come in, it allows us to close our lines of inquiry and to focus in on those remaining areas of concern. As the Minister has said, we have 3 related components to this cluster. We have the City of Whittlesea, where we've already started. We have the Port of Melbourne, particularly associated with a workplace, and of course the Our aged care facility in Maidstone. We have confirmed through genomic testing that all those cases, all 54 cases across those 3 clusters, are all connected, and they all come back to our South Australia case. And I thought I might just start with just a flashback to the Melburnian, to the Victorian, who left South Australia's hotel quarantine system on the 4th of May. We believe, and our colleagues in South Australia have confirmed this repeatedly through their own reviews, and my thanks to them for their work, that he became infectious. He caught the infection on the 4th as he was exiting hotel quarantine. He was on a plane on the same day back into Melbourne. He went to work on the 5th and 6th at TIC, the Pact Group down in Port Melbourne. And then, of course, over a subsequent few days, he went into the city, he had a curry, he visited a number of grocery stores. We identified at the time over 120 primary close contacts across those exposures. And there was a good question yesterday morning around, well, what about earlier in the period? His first movements off that plane were home and to work. All those locations have been fully exhausted. Of course, he returned no positive primary close contacts throughout his exposure period. And of course, all those individuals completed their 14-day isolation period as appropriate. But we are absolutely clear that there is a missing link between this individual and the subsequent outbreak that we've seen into Whittlesea, Port Melbourne and Mercure, confirmed genomically, and we have a number of close adjacencies that the teams continue to investigate. City of Whittlesea now has a total of 28 positive cases. That is an increase of 4 from yesterday. The 4 additional cases for the City of Whittlesea are all existing primary close contacts. People that we knew about from the previous cases, people that had already been isolating, and as such are not generating any further exposures. The Port of Melbourne cluster now has 23 cases in it. One of those, of course, is an overlap case with the City of Whittlesea. 4 of those have actually been reallocated from City of Whittlesea. We have reclassified some of the linkages. We now believe it's a bit closer to some of the Port Melbourne cases. It's a technical thing. Happy to go through it in questions. 4 of the additional new cases are also existing primary close contacts. Again, people we knew about before they turned positive, and again they'd been isolating, so that gives us a little bit of comfort. There is 1 new community case associated with Port of Melbourne. This is an individual who lives quite close to Stratton Finance in Port Melbourne, and who appears to have caught the virus through very peripheral, very tangential contact with one of the Stratton Finance employees. I'm pleased to confirm that he's quite a recent infection. It's a very recent infection indeed. All of his household contacts, people immediately living with him, have all tested negative for household contacts. He has not, we do not believe he's been at work while he's been infectious, which of course again is a relief. And over the last 2 days, the cases that we've been identifying are all relatively recent into their effective period. So that means a much shorter period of them having been active and out and about in the community, and that of course reduces significantly the risk of onward transmission. Again, they'll continue to isolate. We continue that investigative work. The aged care outbreak, no additional cases today, which of course is a huge relief. There's been a huge testing drive. We have now tested 146 people associated with the Arcare Maidstone facility. All of them, bar 3, have returned a negative test result. The 3 positives are the 2 staff members and, regretfully, of course, 1 resident. The Blue Cross Centre in Sunshine, where 1 staff member has also worked, 135 people have been tested in that facility. All the residents and all the relevant staff all have returned negative test results. We continue to, of course, to watch and work very closely with our colleagues at both Arcare and at Blue Cross and Sunshine to provide ongoing support. There will, of course, be ongoing isolation requirements and various lockdown procedures. Sorry, Richard, I'll come back to you. Over 300 exposure sites, those numbers continue to grow. We do continue to reprioritise those, so please keep an eye on those as they move in around. I gave a fairly fulsome update yesterday on the other lines of inquiry, the pubs and clubs, Mount Ridley College, the grocery store network. All those numbers continue to come in. We're still seeing around 3/4 of those, 80% of those coming back with negative test results. We continue to be very focused on them. For today, as the Minister has indicated, we are concerned about evidence, about 4 or 5 instances we've now seen where we have seen transmission in these cases with very fleeting contact. We have transmission at places like the Telstra store in South Melbourne, JMD Grocers, the Mickleham Display Home we talked about a few days ago, and at Craigieburn Central Shopping Centre. And they're all examples of transmission with very limited contact. We are used with previous variants. We're more used to transmission really occurring in the home, in the workplace, or where there is real people knowing each other, already having a lot of contact. All those big social settings. These are quite different, and it's a much more fleeting contact. As such, we are really keen to see people come forward who have been to some of these busier shopping centres where we have seen a number of our positive cases move around a number of times. Those centres in particular are Craigieburn Central, Bay Street in Port Melbourne, Clarendon Street in South Melbourne, Pacific Epping, also known as the Epping Plaza, the Epping North Shopping Centre, and Broadway Reservoir. So if you're a user of those shopping centres, if you've been in and around those shopping centres in the last 2 weeks, I would really encourage you to come forward and get tested. Obviously, anybody who's symptomatic should be getting tested anyway. Clearly, 40-odd thousand people a day are, and that's fantastic to see. But even if you're not symptomatic, if you've been in and around these shopping centres, we are so determined to use this opportunity to really make sure we leave no stone unturned to run this one to ground. So I'd really encourage you at those shopping centres in particular to please come forward and get tested. We have had positive cases circulating in those shopping centres. There is, of course, a full list of exposure sites on our website. Please refer to those, and that will give you more detail. In terms of briefly on vaccinations, and I think as we've already touched on, again, vaccination is our long way out of this. And as Minister Denan has talked about, we are now using 40 clinics now set up to do vaccination across the state. We have the largest state clinic vaccination program anywhere in Australia, and it's wonderful to see so many people coming forward to get vaccinated. If you're standing in a queue right now, the queues are running at about 2 to 3 hours at some of our busier sites. My thanks to you for doing so. Anybody who wants to have access to Pfizer, if you're 40 to 49, please contact our call centre. Please be willing to be patient. Please be willing to try it a number of times, but 20,000 people or so got through yesterday, and a similar number, if not more, will get through today. We want to get you done if you're in the age 40 to 49. If you're over 50, again, you can go through the booking centre or you can walk up. You'll be getting the AstraZeneca vaccine. In addition, 10 of those clinics will be running a separate priority queuing system for aged care, residential aged care and residential disability workers. So if you are working in those sectors, whether it's private or public sector, if you have not yet been vaccinated, we would like you to come and get vaccinated tomorrow or over the next 5 days at any of those 10 clinics. If you'd rather go to one of the other 30 clinics, that's fine too. You'll just be working through the normal booking system along with everybody else. But please take this opportunity to get vaccinated. Just as a clarification, we started vaccinating the public sector aged care workforce and the public sector healthcare workforce at the beginning of this program in February. We provided access to private sector residential aged care workforce 3 weeks ago. So the opportunity is there, the opportunity continues to be there. We're very keen now to make sure as many of those people come forward to get vaccinated. Anybody who works in aged care and disability, in terms of the vaccine you get will be the same as for everybody else. If you're under 50, you'll have Pfizer. If you're 50 and above, you'll have AstraZeneca. Finally, before we take questions, again, my thanks to literally now hundreds of thousands of Victorians who are working so hard to bring this outbreak to ground by getting tested, by getting vaccinated, by isolating, and even by complying with the CHO directions. It makes a huge difference, and we can see it in the activity we're seeing on the ground. My thanks, of course, everybody you will meet in this programme, whether they're in a vaccination centre, whether they're in a testing clinic, they're all working 12 hours a day, if not more. Please be patient and please be kind. Our staff are doing everything they possibly can to get you done. We will continue to do this over the days and weeks ahead to get us through this and out the other side. With that, the ministers and I will be pleased to take any questions you may have.
Just on those fleeting cases,
Yeah.
Can you talk us through, did these people shake hands? Did they talk to each other?
No. So this is stranger to stranger transmission. So the individuals concerned, and it's not one or two, we now have at least 4 instances in this cluster of 54 where people who are unknown to each other before, during and after have clearly transmitted to each other. Sorry,
Councillor, is it the same type of transmission as we saw last year, or is this a new
No,
type?
it's. I mean, look. Clearly, we're in a position now where, with the sheer volume of testing and the sheer amount of contact tracing and focus we have on these cases, we can see a lot more than, frankly, we could see 12 months ago. So we're starting to unpick these at a much more granular detail. Absolutely, will this have happened last year? I'm sure it would have done. What we're seeing with the Indian variant here is we can now really see that it's happening relatively often. With a sheer number of those kind of very fleeting contacts. Most of our traditional approach to this that we've used across the world has been to really focus on those household contacts, those workplace contacts. Do you remember the old 2-hour rule we used to have way back when? So we used to be far more focused on where there was a fair intensity of contact. What we're seeing now clearly is people who are, they're brushing past each other in a small shop. They're they're going around a display home. They're looking at phones in a Telstra shop. This is relatively speaking, fleeting contact. They don't know each other's names, and that's very different from where we've been before.
Is this because of a high viral load?
Well, no, we believe it's a combination of that, Richard. I mean, I think there's obviously, I'm not the clinician here, but there's we think it's primarily a feature of the Indian variant, which is that it is just that much more contagious. Not in every single person. So we're seeing examples where people are not transmitting at all, as is the case with our original gentleman from Woolworths, who we think has only transmitted to one person. But we've got people in this outbreak who have clearly transmitted to multiple numbers of people.
And you talked about 75% of primary contacts
Yeah.
come back negative. The remaining 25% are they positive, or you still?
No. They're coming through. So as the outbreak, as we see these exposure sites, as we see these primary close contacts coming in, 4,800 primary close contacts today. That's another 600 from where we were looking at about 24 hours or so ago. So of course there's a bow wave there. We're encouraging them all to go and get tested. That takes its 20-hour cycle or so. Those test results come in and we start to see them. So we're always going to be a little step behind as we identify new primary close contact. There'll always be a 24-hour lag until we get the results into the system.
These high-risk sites you just read out before.
Yeah.
Are there specific dates for that, or was this all pre-lockdown? I mean, what sort
No. So there are over 300 exposure sites now on our website, and again, I'd encourage people to please use the website for this. What we've identified here is a number of retail strips, essentially precincts where we know some of our cases have been. There are exposure sites on all of these streets, but they've been in these general streets. And I'm using it as a way to get people's attention that says we've seen these positive cases. It is entirely possible that we've seen this kind of fleeting contact in any of these locations, possibly others. So please use the exposure site list as the guide, but this is I want to broaden our appeal.
Do you have concern about these particular sites since we've been in lockdown, or is this all last Thursday?
No, this is. I mean, this as the picture continues to build and emerge. So we started off with you start off with your individual cases. You start to see how it's moving. At the beginning of this particular outbreak, focusing around the city of Whittlesea, focusing around a lot of household contacts. We started picking up some other exposure sites. We talk about those, and we've seen this outbreak continue to morph as all outbreaks do. What we're now doing is really, we're keen to start to drain the swamp that says, well, what else is out there? Is there anybody else out there who we haven't caught yet? Is there anybody out there who isn't being caught up by the exposure sites? Hence, we start to focus a little bit on these retail strips.
Well, I guess the question is, how long do you need to do that, and can lockdown end on Thursday?
So look, my job is to keep driving hard until I've got everybody who's positive under control, locked down, isolating safely. Obviously, conversations around what does that mean for the response are those for the Chief Health Officer.
Are you seeing any more positives outside of the city of Greater Melbourne, or?
No, so at this point in time, we have no new exposure sites outside of Greater Melbourne, and we have no positive cases in regional Victoria. That is, of course, a good thing. I think I just heard the comment, am I confident? Well, look, we have a case today that we didn't know about yesterday. That wasn't a primary close contact. I don't like mystery cases because it's a real cause for concern that it's someone who's not on our network, who we therefore need to find out, who need to contact trace from scratch. We need to find their exposure sites. And this is still a very active and dynamic situation. We've seen this thing morph 3 or 4 times already in the space of the last 8 days. The teams are working exceptionally hard. We're managing, just under 5,000 primary close contacts, over 300 exposure sites. We have a lot more work to do, and we will do that, and we'll continue to do that.
Just on the mystery cases, how many do we currently have active in Victoria?
So we have 54 cases active in Victoria. Yep. They're not mysteries anymore because we have them.
There's no mystery cases left.
No, but the point I'd make is that there's no mystery cases. So every case we have has been linked.
Yep.
Has been linked to either City of Whittlesea or Port Melbourne or Arcare. They're all part of our original Indian variant coming out of SA hotel quarantine. So they're all connected and linked. My concern around the case, one of the cases we've identified in the last 24 hours, is they were not known to us beforehand. And that means that he's done the right thing. He's come forward to get tested because he was feeling a bit crook. But we've connected him into the outbreak. But we now have to go back 3, 4, 5 days and say, what else has he been doing, and are there any other risks and exposures? That work's obviously been going on for the last 12 hours, and that will continue.
So that
Yeah,
connection to Port Melbourne,
Yeah.
just lives near the Stratton Finance?
Yeah, he lives around the corner from Stratton Finance. He's got exposure in a number of the coffee shops and units around there, also frequented by Stratton Finance employees. There's some exact matches in terms of that contact, and again it goes back to that theme around peripheral contact. What we're seeing here is an individual who has had relatively infrequent, relatively fleeting contact with, we think, a couple of people over 2 days. That appears to have been enough to get this infection across.
How many cases don't have sources? We heard yesterday that first aged care worker, we didn't know the source for that one. Is that still the case?
So we have 2 or 3 lines of inquiry at the moment between between the 4 individuals around our care and the City of Whittlesea Port Melbourne cluster. We haven't defined what was the actual vector that they came across. There's a number of different scenarios. We're still working on that. What we're very, very clear about today is genomically, they're all connected.
So in total, how many cases in the clusters combined do we not know the source of? So
in terms of the precise connection, there are 2. There is the connection between our Victorian from Woolworths, who arrived back into the state on the 4th of May. The connection, bluntly, between him and case 5 has not been precisely established. Again, we have 2 or 3 potential scenarios, and we have the connection from the aged care cluster. There's a couple of different routes it could have taken from there to the wider City of Whittlesea Port Melbourne cluster.
And then the one from today as well that's under investigation?
No, the one from today is clearly linked. We know what the linkage was and where that, we know the venue where that happened. We know what case it was associated with.
In terms of, you said door knocking, there's been good compliance.
Yep.
Has it been 100%, or have there been cases where people aren't home?
No. So yesterday we did, again with our authorised officers, and again, shout out to our authorised officers teams. They're out there at all times, in all weathers, really providing support to people who are isolating at home and just making sure that they're in the place they should be. We do it by telephone, of course, as well. We checked on physically 723 addresses yesterday with support from our colleagues in the ADF, and the ADF have mobilised really well to do that. We found 8 individuals of real concern yesterday who were not where they should have been. They're all being followed up through our enforcement division.
Well, this sounds relatively optimistic. When you said draining the swamp and just getting into the nitty-gritty detail, yesterday we heard we were neck and neck with this virus and that was spreading quickly. Do you still believe it's that close? It sounds like your team is on top of it.
Oh, look, I think operationally we're running all the metrics you would look at for this. You would say we are running exceptionally well. We're running fast, and we're doing it because we're being supported by people doing the right thing. So testing numbers are high, vaccine presentations high, the engagement with the different bits of the community to understand what's going on, that's all working well. But I don't know what I don't know, and it's a big swamp. This is the biggest outbreak we've seen in Australia this year. It's one of the most it's certainly the fastest moving outbreak I think we've seen anywhere in Australia, for a long time. So I'm not taking this one lightly at all. I'm confident that we're doing everything we possibly can to get on top of this, and I'm confident that all of us as Victorians are out there willing this thing to be over and willing us all to get on top of it, and by behaving in the right way. But as we saw yesterday, you are only one positive test result away from having to go down another whole rabbit hole. So there's more work to do.
You've been quite deliberate with the handball back onto South Australia with this decision.
Yep.
Is there any chance the missing link was on the plane with this man?
So we don't think so, Richard. And look, and I think we've tried to do this consistently. There is absolutely, we are not pointing a finger about where this has come from. Not for the moment that we work exceptionally well with our colleagues in South Australia, as we do in all states. All of us are, professionals trying to do a very difficult job, and we're all on the same side, which is trying to get this thing done for Australia. In terms of we have followed through other, the manifest of the plane, but we are very clear, and our colleagues in South Australia have confirmed this. Through their fantastic detective work, they've narrowed down the point of transmission, the point at which he caught it, on the 4th of May. He was on the plane the same day, literally hours later. Now, we have seen no evidence anywhere in Australia of somebody becoming exposed to the virus, incubating it and becoming infectious within 3 or 4 hours. That's not happening.
You talked about the 2 or 3 potential links between case 5 and the Woolworths man.
Yeah.
Can you explain what those links are? And then further to that, On the 5th and 6th of May, you say he only went to work and at home. Were there any other exposure sites that he may have been to on that? Maybe that weren't listed as exposure sites, but other places he went to that day that have been looked at in terms of their links to future cases?
Yeah, look, and it's a really good question, and I think Rachel asked the same question or a similar question yesterday. So we've tracked back again on the trajectory of our Victorian in Woolert, and very clearly he arrived at the airport, he went home, he went to work by car in Port Melbourne at TIC Pact. He then made a number of movements on the 7th of May from memory, the Friday, and then again on the Saturday, the 8th. So 5th and 6th, those middle days, he was essentially just going backwards. He worked from home one day and he was by car. There was one stop at a 7-Eleven, I think it was a 7-Eleven servo. That site was listed, so every single exposure point he's had has been listed publicly at the time, and we've gone back and checked all that again and again and again. The connection points, without getting into all the personal details, which I don't think are necessary, the connection points are we think there is, our scenario is there are one or two other people in the community that he's infected through one of his exposure sites. If I look at the restaurant, the curry restaurant that he was at, we know we had to do a lot of hard work to find the 40-odd people we did find in that restaurant. There may well have been a 41st person that we didn't find, that didn't come forward at the time after all the work that you guys did and we did to try and identify people. So it's possible that we've got somebody in the restaurant. He took 2 train rides. It's entirely possible that there was transmission within the train ride. Those are the lead scenarios. And he was at a number of grocery stores on the weekend. Again, possible that there was, again, that peripheral transmission we've talked about, that took place at those grocery stores. None of them from the 5th or 6th, no, because he wasn't going anywhere on the 5th or 6th. And bear in mind, we did a very comprehensive job with TIC Pact with the workplace around the office staff. There were about 23, I think, from memory, 23 people in the office who were fully PCC'd, tested, isolated for 14 days, and people in the warehouse.
Just another question that's slightly historical. Yesterday and the day before, you've listed exposure sites dating back to the 11th and 12th of May.
Yep, that's right.
How are you determining that these individuals were infectious dating that far back?
So the way we operate this, and there was a recent case we identified, I think 2 or 3 days ago, the Slade Drinks cases, as we probably call it here. So in finding that positive test result, in the conversations with the case, they identified being symptomatic right back onto I believe the 14th of May. So their self-declared, I started feeling a bit crook, was quite a long time before that. We then pulled that forward by another couple of days to say, well, that would be a presumed infectious period. Those conversations with the case are being reviewed again and again. We've also obviously looking at the level of infectivity that he has. So our clinical specialists, clearly not me, are looking at his infectious status. I think our understanding this morning certainly is that his infection profile looks like it's still going up, which makes it more likely that he was not infectious earlier on in that period. But out of abundance of caution, we'll just list those exposure sites and get it moving. If we then end up pulling those back, if we make a judgment later on that he might not have been as infectious, we'll pull it back.
Can I just ask about regional Victoria, and it may be something that the Health Minister wants to comment on as well. Sure. If there's been no cases in regional Victoria or no new exposure sites, would it make sense that if our lockdown was to extend, that regional Victoria stands a chance of opening up on Thursday?
So that's a matter for the Chief Health Officer to take a view on.
May I ask the Health Minister about it as well, though?
Yes, you can, and the answer is going to be pretty much the same. The public health team are currently going through all of that data. We've still got, particularly at Axedale and Kahuna, a number of people in quarantining, and they might well turn positive. Let's hope not, but so far so good. The Chief Health Officer and the public health team will make recommendations based on all the most up-to-date intelligence and material that's available. And as soon as that recommendation is made, and as soon as that goes through the processes, we'll be up talking to the people of Victoria about what the next stages are. But at the moment, as the Acting Premier and the Chief Health Officer made clear yesterday, it continues to be a day-by-day, case-by-case proposition. We are finely balanced. This is a significant and very concerning outbreak.
But as part of potential measures that could be adopted after Thursday, does that include the ring of steel between the regions and the metropolitan Melbourne region?
Well, all depends on what the recommendations from the Chief Health Officer and the Public Health team are. If the recommendation is one way or the other, we'll be following that advice. It's too early to predict at the moment.
Is it being considered?
Can you give us any indication?
It's not being considered by me because I haven't got a recommendation from the Public Health team. They're going through, literally as we speak, all the data, all the intelligence, all the up-to-date information from Jerome's operational people, the work of the public health teams. But as we saw yesterday, it doesn't take much for this highly infectious variant of concern to pop up in really risky settings. As the COVID commander indicated, we still haven't linked the RCare index case. Whilst we've genomically linked it, we haven't linked that case yet with either Port Melbourne or Whittlesea group, and that is a matter of real concern. We are extremely concerned about making sure that our most vulnerable residents, our most vulnerable Victorians are protected, which is why Minister Donnellan's announcement about helping the Commonwealth out in delivering vaccines for particularly their priority groups is something that we were happy to do.
This is only 2 days away.
Yesterday, the Chief Health Officer said that the ring of steel is not out of the question. The Police Association Secretary said that he didn't necessarily think that last year's ring of steel was effective or efficient.
Yes.
If you did implement it this week, how would it be any different to last year?
Well, I welcome the Police Association's views. I welcome the Chief Commissioner's views. And when a recommendation, one way or the other, comes from the Public Health team, we will, of course, take all of those views into consideration and, of course, talk with all those parties. But I've got to stress there has been no decision as yet. And as soon as there is a decision, we will be out and about via a forum like this as quickly as possible to share that with all Victorians.
Right now, when it comes to businesses, we're seeing large-scale food wastage. The 7-day right now, because of the lockdown, we're seeing large-scale food wastage. It's estimated that this 7-day lockdown will cost the economy about $1 billion. What reassurance can you give to businesses regarding a lockdown extension, or will they be left in the dark until Thursday?
Well, I refer all Victorians and particularly our business community to the comments that the Treasurer and the Acting Premier made when they announced the business support package the other day. And I can guarantee that as soon as a decision is made, that Victorians, businesses and the wider community will be brought into the confidence of that as quickly as possible. But I stress our public health team are going through the process of looking at the data, looking at the risks, looking at where particularly the high-risk cases are. And I stress we have an unlinked case in aged care. Our aged care, particularly our private residential aged care, knows more than any other group that how devastating this COVID-19 can be. And we need to act according to those risks and according to that advice. And as soon as that advice is made and as soon as those recommendations are adopted by government, we will be out talking to Victorians.
How much warning are you expecting to give Victorians if there is a lockdown extension?
The longest, firstly, I don't know if there's going to be an extension or not. We are in, as the Acting Premier pointed out yesterday, there is every prospect that things might get worse before they get better, and the aged care settings are quite troubling. Yes, we are making significant inroads through our contact tracing, through our support from millions of Victorians who are following the rules and doing the right thing. That is helping all of our processes. But we are not yet in a position to make that call. And as soon as we are, we'll be certainly coming out and sharing that with all Victorians.
You've come out proactively today, talked about this incidentality, the fleeting transmission that you're seeing. It effectively means that, unlike last year's outbreaks, people who attend an exposure site, not with a primary contact, not with someone, is at risk of being infected. That opens up the infections to a whole wider range of people. How much does this new evidence weigh on your decision to extend the lockdown? Does it mean that effectively you guys want to snuff it out for there to be no mystery cases for a long time before you're comfortable opening up again because of this new virality or virility?
So these are all, Paul, precisely the questions that our public health team, as we are standing here now, are currently considering. You've got to take your decision based on the evidence that you have before you. And the evidence of the Indian variant is that it travels faster and is more infectious. And we're starting to see that present itself, as Jerome indicated, in different ways than we have in other outbreaks. And that is one of a range of pieces of evidence that the Chief Health Officer and his team will weigh carefully, and as soon as their decision and recommendation to government is made, we will be letting Victorians know.
I know Julie's just asked this, but do you have an indication on when you're likely to announce either an extension or a sticking to the current timeframe? Will it be on the day before? Do you need to see the next 2 days' numbers, or are you pretty confident in your view now?
Oh, well, I'm only as confident as the last test and the last piece of data that we receive, because we know that this is so unpredictable. Whilst we increasingly come to understand how the virus moves, and our knowledge, both in Australia and globally, has gone ahead in leaps and bounds over the past 18 months. But it is still, in many ways, a rapidly evolving virus that is a real challenge. And I can't share with people what we have yet to land on through our public health teams. And as soon as we do have those recommendations from our public health teams, we will be making those announcements to the people of Victoria.
Do you know when the recommendations will be made?
I beg your pardon?
Do you know when the recommendations will be made?
No, I don't. When the Chief Health Officer and the public health team are satisfied and confident in them having enough material to bring that recommendation to government.
If we're talking about this outbreak being a day-by-day proposition, Mr. Foley, if yesterday was pretty grim, how does today compare?
Well, every day in a global pandemic is pretty grim, and we need to make sure that the hard work that all Victorians are putting into this outbreak, that the real risks that we are facing, particularly at our aged care settings, particularly at our high-risk private residential aged care settings, are taken into account. Victorians have sacrificed more than anyone else around the nation when it comes to making sure that we got, as we very recently had, 86 continuous days of no community transmission. What we want to do is to make sure that our efforts reflect the value of that sacrifice and avoid the risks that we saw last winter of the devastation that this causes in private residential aged care. I think Victorians would expect that of their government, and that's what we'll be doing.
So what's your message to business owners, I suppose, that are waiting in anticipation to see if this will be extended? What's your message to them?
Well, my message is that message that was delivered by the Treasurer and the Acting Premier, that we know that this is a really difficult period. That's why we've put in place the most recent business support program, and that's why we are keen to engage in conversations with business, with other levels of government, to continue what can further support look like. And as soon as a decision is made, we'll be sharing it with business, and of course we'll be sharing it with all Victorians.
Some of those businesses only received 2,500. I mean, it really kind of barely scrapes the bottom of the barrel. So, you know, what assurance do you have for them? Will they receive more financial support? Not being either the Treasurer or the Minister for Employment, but I do know that the package that the Treasurer launched on Sunday in a pro rata sense and in its coverage of different sectors was the widest one that any state government in the country has put out so far during the course of this 18-month global pandemic. And I know it to be relatively generous, but of course it could have been more generous if our friends from the Commonwealth chose to partner with us now in a non-job keeper environment, in reflection that in many ways what the Victorian people are doing as a result of this case being seeded from South Australian hotel quarantining is doing the hard lifting for all of Australia. And I'm pretty sure that Victorians are still Australians, and I look forward to continuing to work with the Commonwealth in the public health space, and I'm sure the Treasurer looks like is keen to work with the Federal Treasurer when it comes to business support.
Just as a federal government, Senate estimates today heard that less than 10% of aged care workers in the private sector, which is the Commonwealth is responsible for, less than 10% have been fully vaccinated against the coronavirus. The minister responsible, Minister Colbeck, was unable to tell Senate's estimates how many had been vaccinated. Is it your opinion that he should lose his job?
Oh, well, it's not for me to comment on who's got what job in the federal ministry. We work closely with the Commonwealth. They regulate that sector. They've got the data. Today's announcement by Minister Donnellan is a demonstration of how we want to partner with the Commonwealth to fix this very issue. The Commonwealth have made it clear that originally under the Phase 1A, 1B schedule that this was a sector that they were going to look after. A few weeks ago, they asked all the states to assist in that process. The states did. And today we're starting a significant contribution that will come out of Victorian state allocations of vaccine to target this really high-risk group. In regards to the data, we don't have sight of that. That's an issue for the Commonwealth in the sectors they regulate, and you know, I'm not going to comment on Senator Colbeck's future.
Vaccines for people in aged care and disability settings. How many people do you think you need to vaccinate? How many people is the state stepping up to? Because you must know, because you need to allocate how much vaccine you've got.
Because we're picking, Richard, because we're picking our biggest centres where the access for priority for both private residential aged care and National Disability Insurance covered disability workforce, we're taking a bit of a punt that people will come forward in large numbers, and we've got enough reserve in our biggest sites, we think, to address that. Specific numbers, we actually don't know because we don't have access to that Commonwealth data. We've made informed guesses based on the advice that they've told us, and we think those informed guesses will be able to meet demand.
In terms of the rollout for 40 to 49-year-olds, people living outside of regional hubs, and I think in Mildura it's 4 hours to get to Pfizer. Yes. Is there any plans, or are you trying to get some Pfizer out to places like Mildura, Latrobe Valley, etc.?
The short answer is yes. So we recognise that even though we've got a wide coverage of state-run Pfizer clinics in the 40 to 49-year-old groups that we announced last week, we are talking with the Commonwealth and with other providers as to how we might be able to expand that. But I stress that's all comes down to the issue of supply certainty. We will deliver in the most timely and effective manner the vaccines that are made available to us. We've got certainty for a respectable period of time ahead of us, but if we get more and have more certainty, then that gives us the confidence that we can deliver more vaccines widely across the whole of the state. And those two areas that you identified are particular areas that we want to work with the Commonwealth in expanding coverage.
Health Minister, we're in the midst...
Aged care workers should have access to state vaccination hubs. Did your government consider before today making that call? And just in future, could this be expanded to, say, meat workers or other high-risk workforces in future months?
We did consider it. In fact, we wrote to all the providers some weeks ago encouraging them to make the letter that we provided them to their staff to come forward to do precisely that, Paul. So what today's announcement is just raising, as Minister Donnellan put it, the enthusiasm level for that. We were a bit disappointed at the low level of take-up about a month ago. Sadly, it's taken this outbreak, and particularly the risk in private residential aged care in Maidstone and Sunshine to focus attention on that. That's disappointing.
By the nursing homes themselves, I mean, was the low take up by the providers to actually get their staff vaccinated?
So the rules seem to change over the course of the rollout. So we were all working on the basis, as the state was, that when we vaccinated in the public residential aged care sector, the residents, that we also took the opportunity to vaccinate the staff. The Commonwealth program just focused on the residents, and there was arrangements in place for the staff if they were there at the time and there was leftovers, and other arrangements on a different basis. But as a result of some of those issues, all the states stood up a couple of weeks ago, as that date that you indicated, to indicate that we were prepared to support the private residential aged care system through our systems. In Victoria, we wrote to all those providers. There was a degree of take-up. Remembering, of course, that most of the vaccines that are in fact distributed in Victoria are still through the GP network, and many of these people, if they have been vaccinated, may have gone to their GP network, but we don't have oversight of that data. So we know from these most recent cases that significant numbers of those private residential aged care service staff and disability, NDIS disability staff, are not vaccinated, hence our priority call for the next 5 days.
Just on the disability sector, Senator...
I'll go around.
Oh, okay.
I'll start here and move around.
Thank you. Just another Senate estimates question on the disability sector. So Senate estimates this morning heard that only 355 people out of more than 22,000 Australians living with a disability in the sector have been vaccinated. How scared are you of the virus getting into disability care homes?
Oh, look, I'm always concerned that any community transmission may, which we have clearly in Victoria at the moment, may end up in our most at-risk settings. We've seen it in the last few days in private residential aged care, and I would be extremely concerned if it got into NDIS-covered residential disability services. My understanding is that the Commonwealth have, through private contractors, committed to ramping up their in-reach services into those disability services. My understanding is also that that doesn't cover staff, hence our announcement today that we want to prioritise those staff in our next 5-day blitz in this area. And of course, if you can't make it to one of our state blitz areas, you have, as a either a disability or a residential aged care worker, the right as any other Victorian to go and see your participating GP to get your vaccine.
But just, are you
last one, then I'll move across.
Just, are you satisfied with the Commonwealth's rollout, given how devastating it could be if the virus got into the disability homes or aged care homes for that matter? I mean, obviously we saw last year, if there's a large-scale outbreak, there's a potential for a lot of people to die. So do you think that the Commonwealth rollout has really let down vulnerable Victorians?
I think we will all be only satisfied when every Victorian who is eligible to be vaccinated is vaccinated. We can't rest as a community. All levels of government need to put their shoulder to the wheel together to achieve that outcome. And of course I'm concerned. That's why today the government is prioritising at the expense of other Victorians who would be eligible under the ceiling of vaccines that we've been allocated to deliver to precisely those workforces that are priority access. These are people who care for our most vulnerable residents, who we saw in 2020 in both Victoria and to a lesser degree in New South Wales. The virus got into these workplaces, not through residents, not through participants, but through a workforce contact. And we need to make sure that those workforces are vaccinated, not just for their own good, but primarily for the good of the people that they care for and look after.
Health Minister, we're in the midst of the fourth lockdown to impact Victoria. Yes. You've still got concerns for mystery cases. Can you tell us why we're not hearing from a Premier or an acting Premier today?
Well, the Premier is on sick leave, as you may have noticed, and the acting Premier has been out on more than every other day, and he is working incredibly hard right now to make sure that this state gets through this outbreak. And I want to acknowledge the acting Premier's really hard work and leadership in that effort.
Is Daniel Andrews receiving daily briefings about Victoria's COVID status?
I believe so.
And who's giving those briefings?
The acting Premier.
Minister, yesterday you said you wouldn't be critical of the federal government. This morning a post has emerged from your Facebook page on Scott Morrison's post. Did you post that, or was that one of your staff members? It was quickly deleted after.
So no, I didn't post that. Very fortunately, I don't have any, I think it's called administration rights on my social media channels. I leave that to people under 50. And I was disappointed that happened. And I think if any minister right around all of the states has demonstrated a capacity to work as cooperatively as possible with the Commonwealth, I might claim that title.
Does that comment reflect your views?
No, they do not.
The Commonwealth has been blamed yesterday for the fact that aged care workers were working between multiple sites at Commonwealth-run facilities.
Well, not by me, they weren't.
Can you guys confirm, can your government confirm that disability workers at state-run facilities aren't working across multiple sites?
Can I
confirm whether disability workers are working across multiple sites?
I'd have to get advice from the Minister for Disabilities, who's unfortunately had to leave for an urgent meeting. But we can follow that up. Someone signalled wildly at me, but we can certainly get back to you about that. Oh, he's back. Pardon me. So I might ask Minister Donnellan to respond to that.
I'll just get you to respond to it. Yeah.
Is it just on another matter? Are you able to tell us how much the state government paid for the former Urella building for the safe injecting room? And what do you make of comments from the police union that likened the government's stance on this to a television comedy?
So the Victorian government paid $40.3 million for that site, which was on the market for well above $45 million. And in terms of the comments that you've referred to, I don't think that's accurate. What I'd say is that no decision has been made yet as to the location of the supervised injecting facility. We are looking and continuing to look through a process of a number of sites. This is a site that is in a really important strategic location, and whatever use the Victorian government may put it to, health, education, housing, social support, it's a really good buy for the people of Victoria.
In terms of the vaccine, given that one of the aged care staffers had one shot of the AstraZeneca vaccine, do you have any updated detail, given what we now know about how effective it is, as to the protection of people from the Indian strain based on how much of the AstraZeneca vaccine they've had versus the Pfizer, one shot versus two shots?
So I'm not a clinician,
of course.
But there are widely available dissertations from the World Health Organization, from different agencies globally, that point to the fact that one vaccine, Pfizer or AstraZeneca, is a really good start and certainly can assist in keeping you well with very high levels of protection. Two is of course better, but if there's any further material that's more up to date, I'll make sure our public health team and clinicians can get that to you. And I'll get Luke to answer your question.
Thank you.
Sorry, what was the question again?
The question was, are disability workers at state-run facilities working across multiple sites?
We've got, there's a couple of bits of that question. The residential sector, in terms of residential accommodation, got transferred as of, I think, last night, fully to the Commonwealth. So we had 45% of the residential, provided 45% of residents for people with disabilities. So that actually got transferred to the Commonwealth as of yesterday. That's been a process of transferring multiple facilities over time. So that happened yesterday. We had the worker mobility reduction payment in place and have had that up till literally last night in place to minimise, well, literally to have one worker, one site, full stop. So that's been in place until literally last night. I've raised that with the Federal Minister, specifically to say that obviously with the transfer of those 45% of the remaining residences, that the worker mobility payment we won't be paying anymore because they're no longer under our governance and we're no longer responsible for them under the NDIS agreement. So I raised that with the Minister last night for consideration, and I expect over the coming days she'll be back to me pretty soon. Oh, I don't think it's up to me to rate any people's performance. You know, that's a federal government's ministry, and you know, my issue is to work with them to ensure that I get as much coverage as I possibly can in terms of the residential aged care, private and not-for-profit sector. That's really my focus more than anything else, to work with them to actually get that coverage, which I'm so concerned about at the moment.
Their rationale, Minister, on removing the grant in November that they implemented in July or June or whatever it was that it was too burdensome on the aged care facilities, which a lot of which don't make any money, to have to employ a single set of staff because the workforce is so transient, and they only bring it back when there's a hotspot or a community transmission. Is that fair enough, or should that be the ruling at all times into the future from now on?
Well, look, we made a different assessment in terms of our public sector residential aged care facilities. We kept the one worker, one site. We had 100% compliance in metropolitan Melbourne and 98% compliance in our regional facilities. So we made a separate assessment that we needed to keep it going, and that's what we did. So our assessment is separate, you know, and different from what the Commonwealth's assessment was. We believed we needed that protection in place, and that's what we proceeded to do.
Do you think the federal government needs to set clear targets about how many of the workforce in aged care need to be vaccinated?
Oh, absolutely. Yeah, absolutely. Look, that's got to be sped up, and that's why we've stepped into that. But, you know, the Commonwealth really needs to move that along. It's simply not good enough. When we've got community transmission, we haven't got the protection in the workforce we need, and then subsequently we haven't got protection for our most vulnerable people in residential and disability care.
And should the single site payment be extended or continued?
Well, we've obviously made a decision that we think it needs to keep going. That's what we've done, and we very much, you know, I welcome last week's announcement that they will put that payment back in place. You know, let's make sure it's kept there for them, you know, this period of time, because we need it.
Until at least 3/4 of the workforce are vaccinated? I think that's what your federal colleagues have...
Look, I don't have a particular figure in mind. I'd like to see them all vaccinated, to be blunt. You know, that's as much as humanly practical, subject to some people who might, you know, not be able to have a vaccine, but, you know, I'd like it to be an incredibly high level so we provide protection to our most vulnerable people. You know?
If they're unwilling to do it, if they're unwilling to continue the single site payment into the future, is there something the state can do? Is there any policy lever the state can pull or incentive the state government can put in place?
We've got the public health orders in place, and the public health orders have continued to be in place during that period of time. So where practicable, minimise the staff to 2 sites at most, preferably 1 site. So they're in existence today. You know, we don't have governance and control of the private sector in terms of, and the not-for-profit sector in residential aged care, but we've certainly got the public health orders out, and they've remained the same through that period of time.
But the public health orders were in place when when the worker from our care went to Sunshine, Blue Cross at Sunshine. It doesn't look like she's infected anyone, which is great, but she could have, right? And that would have put the lives of all of the residents at risk, given they're vulnerable to the virus. Is there anything that you can do further than the public health orders to protect aged care and disability care residents?
I don't think we have a legal capacity to enforce that in the private and not-for-profit sector presently, so I'm not going to pretend we do, but I would have thought public pressure and public expectations would be that they would keep moving along that path and actually do the right thing and minimise the movement of staff across the across residences. And I suspect that you know, in terms of the public reaction, if it's not done properly, I'm sure we'll find out very quickly, because I suspect there'll be people who work at those sites who will, you know, talk up and actually highlight that's not being done properly. So, you know, I'd very much expect the Commonwealth to enforce that and do it well.
We've lost the State of Origin match. It's more than just a game of league. It's an economic
I love
boost.
the State of Origin. Yeah, big supporter.
Do you have, well, firstly, how much did we pay to get that game? Secondly, what's the loss worth?
I couldn't tell you that. I'm very disappointed that, you know, I won't be seeing Cameron Munster and others play in Victoria. You know, I love rugby league, but unfortunately I can't give you a, well, I haven't been briefed in terms of the costs, so, you know, I'd have to defer that off to Martin McCauley.
One for the Health Minister, is that all right? Thank you. Just a quick one. Thanks so much. We were told that Daniel Andrews would be back at work in June. It's June today. Given that you've just confirmed that the acting Premier is briefing him daily, when is he going to be back on deck?
As the acting Premier made clear yesterday, the Premier released a statement in the not too distant past thanking Victorians for the warm wishes for his recovery and indicating that his recovery was progressing well and that he expected to be back in June.
Do we have a date yet? It is June.
Yes, today's the first day of June, and I'm pretty sure it goes for a few more weeks yet.
Do you think you should have made a public statement during this lockdown?
No, his focus is on recovery, and at the same time, there are very few decisions. In fact, I'm pretty confident there are no decisions of suitable import from the budget, from the direction of strategic actions of the government that are taken without the Premier being thoroughly aware.
So is he making some of the daily decisions?
Beg pardon?
Is he making some of the daily decisions?
There are millions of daily decisions made across government, and the Premier is not making those daily decisions. The acting Premier is in charge and is in close consultation with the Premier.
Has the acting Premier asked him about whether he'd support an extended lockdown given where we are now?
Well, I'm not the acting Premier, so I couldn't tell you.
Is he going to be back on deck tomorrow?
I beg your pardon?
Is he going to be back on deck tomorrow, taking questions?
I don't know. He'll come back when in accordance with the public statement that he's made in accordance with his medical treatment.
The acting Premier, is he going to be coming to press conferences tomorrow and throughout the week?
Well, the acting Premier has been so thoroughly publicly accountable during his term as acting Premier, and I'm sure as the needs continue to arise, the acting Premier will be making all the public commitments that he needs to be making. Everyone happy?
Unvaccinated aged care workers, will they be stood down or allowed to continue working?
Unvaccinated
Aged care workers.
aged care workers. Well, if they're private residential aged care workers, that's not a decision for the state. I do note that yesterday Minister Hunt and I think the Prime Minister both indicated that they would be referring precisely that issue to an expert medical panel. I look forward to that expert medical panel reporting as quickly as possible. Our position is that we will try to follow as much as we possibly can all of those national frameworks, but we do genuinely seek to exceed them, particularly in this space, and I think our record speaks for itself in that regard.
So for state-run workers at state-run facilities?
Well, we already, you might have seen yesterday some public comments that the Secretary of the Department of Health made about any public health worker who is in a publicly facing a publicly facing risky workplace. The expectation is that you will be vaccinated. The history of whether it's flus or whether it's other vaccination programs in the past shows that we have stuck to that position, and our COVID delivery of, as the COVID response commander referred to earlier, for our public-facing public healthcare workforce is extraordinarily high, much, much higher than the private residential aged care and healthcare sectors. And in the very small number of cases where, for whatever reason, people in the public sector don't take that step, they face the prospects of being stood down.
Sorry, just one more from me. What do you make of allegations this morning that the home at the centre of this outbreak is accused of encouraging potentially exposed?
Could you say that again?
What do you make of allegations made this morning that the centre at the facility at the centre of this outbreak is accused of encouraging potentially exposed workers to come to work?
Well, I'm not briefed on those matters. That would be very disappointing if it were the case, and it would be a breach of the public health orders.
Will they be fined? Will they be penalised if that's the case?
Well, there'll be, if there's accusations made, they'll be investigated in the normal process. So if people have made those concerns, I would urge them to bring them forward and let the authorised officers or Victoria Police know, and the matter would be investigated and considered on its merits as a matter of priority, I would have thought. Thanks, everyone.
Right.